This video is for general information only and isn't a substitute for medical advice, so please do speak to your GP or a qualified healthcare professional for guidance tailored to your situation. Are penile constriction rings, sometimes called cock rings, actually useful for erectile dysfunction, or are they just a gimmick? It's a question a lot of men have, and it deserves a straight, honest answer. Erectile dysfunction is more common than many people realize, and it can have a real impact on confidence and relationships. So it makes sense that men look for practical solutions, including devices like these. Let's start with how they actually work. A penile constriction ring is worn around the base of the penis. When you're aroused, blood flows into the erectile tissue to create an erection. Normally, some of that blood drains away through the veins. The ring applies gentle pressure at the base to slow that venous outflow, helping to keep blood in the tissue for longer, which can result in a firmer erection that's easier to maintain during sexual activity. Now, here's an important distinction that often gets overlooked. There are two very different categories of these devices. Consumer rings sold as sex toys are not included in NICE first-line treatment options for erectile dysfunction. They provide mechanical support in the moment, but they don't address any of the underlying causes of EDE, things like cardiovascular issues, hormonal imbalances, or neurological conditions. Medical-grade constriction rings are a different matter. These are typically CE or UKCA marked devices, used alongside a vacuum erection device, essentially a pump that draws blood into the penis before the ring is applied to maintain the erection. This combination is recognised in the UK as a second-line treatment for erectile dysfunction. If you're considering any of these options, it's really worth having a conversation with your doctor first. They can assess what might be causing your erectile difficulties, because ED can sometimes be an early sign of an underlying health condition like cardiovascular disease, and a proper medical assessment really does matter. On safety, if you do use a constriction ring, there are some important guidelines to follow. Keep wear time to a maximum of 30 minutes. If you experience any pain, numbness, or discoloration, remove the device immediately, as these are signs that circulation is being affected. And this is critical. If you develop an erection that persists for 2 hours or more, go to A&E straight away. Prolonged constriction can cause permanent tissue damage, so please don't wait and see. So to recap, penile constriction rings work by restricting venous blood flow to help maintain an erection. Standalone consumer rings are not included in NICE first-line options for ED and don't address underlying causes. Medical-grade constriction rings used with vacuum erection devices are recognised as a second-line option in the UK, and erectile dysfunction always warrants a proper medical assessment. If you found this helpful, give it a like and subscribe for more straightforward health information from Bolt. And remember, speak to your GP or a qualified healthcare professional for advice that's right for you.